Welcome back to We Do the Heavy Lifting. I'm your host, Dr. Jenna Yentis, and today we are going to talk about physical therapy in the Air Force, and specifically in special operations. And you may be thinking, the Air Force has special operations. Is this like a Navy SEAL? Is it like an Army Ranger? We'll get to that, don't worry. And our guest today was one of our Hilliard Discussion 13 speakers and guests, so we're very excited to have him here. It's Major Evan Carson. And you are an operations medical readiness commander.
Yes, yeah.
And you work in a special tactics squadron.
Yeah. Right. It's a
under
mouthful.
Special Operations Command. It is a mouthful. I had to
Yep.
give it last night for your intro.
Yep.
Do you want to tell people a little bit about what those words sort of mean, a little bit about what you do kind of on a daily basis?
Sure, yep. So my actual title is Operational Medical Readiness Flight Commander. So basically I lead a team of about 15 people. We have four different specialties within that. So we have a sport medicine pillar, which is myself, a strength coach, and an athletic trainer. And we have a medical pillar, which is a flight surgeon or just a general family doctor that also specializes in aeromedical considerations and risk. A physician assistant. We have a handful of medical technicians and a logistics airman. And then we have a chaplain and a chaplain's assistant, and then 2 psychologists. So kind of a diverse team, but the idea is that we kind of holistically care for the operator, and we have rapid access to care and also focus on prevention. So we're right there with the operators living in the unit.
That's pretty amazing that those, what did you call them, operators, have that type of care immediately available. I don't think, from when I think about the military and the way structure is, I don't think of it that way at all. Anyway, I think they have to go to Walter Reed or something like that.
Exactly. Well, that's the case for, 95% of the military. But in SOCOM, or the command that's over all special operations within the military, they prioritize that rapid access and that holistic care that I'm talking about. So like I discussed last night, they have set apart a huge pot of money to make sure that those services are embedded in units like mine.
Yeah. You were saying something very interesting last night, that the cost to get an operator to that point, to train them, to build them up, to get to that point, it's, for taxpayers listening to this, it is worth your money to have these folks in the unit,
right? Because
it costs so much money to get them to that point that you want to keep them in the best care possible.
Yeah,
in the best shape.
Exactly. These it depends on the flavor of operator. We have 4 different flavors of operator in Airforce Special Tactics: combat controllers, pararescue jumpers, tactical air control party, and special reconnaissance airmen. So that's a mouthful too.
Yeah.
But
it always is with the government.
I know,
it's okay.
right? And there's acronyms for all that, but I'll spare you those. Those guys all undergo different pipelines to get to where they're at, to make them like a, no kidding, operationally ready operator. But they're usually around 2 years each, those pipelines, and they're grueling. And so professionals like me and my team are embedded all along at nodes in that pipeline as well, not just at their final operational squadron, if you will. So they're taken care of along the way, the whole way. But it does take about $2 million to get them through that pipeline, and then a few years into their first squadron. So it does behoove the government and the taxpayer to kind of nurture them and provide for them once you get them to where you want them.
Absolutely, absolutely. And so I kind of touched on it at the beginning. Is there training in the way, do we think of special operations in the Air Force the same way that people, maybe that Hollywood has glorified Navy SEALs or something like that? Is it as similar, to give people a little picture of the kinds of things they do? Could you just paint a wide brush of?
Sure. With all due respect to the Navy SEALs out there and the Army Special Forces and all those guys, those are incredible people as well. For the layperson, you can think of combat controller along those lines. They're like those operators. However, their specific job is to talk to airplanes. So they're carrying lots of radios, lots of batteries, and their specific job is to land airplanes in austere areas, to designate airfields out in the middle of nowhere. The pararescue jumpers, like discussed last night, battlefield medicine, casualty evacuation. They are really good at fighting their way in to rescue like a downed pilot in that kind of scenario. So they're like Navy SEALs, but they don't focus on like the direct action assaults and things like that the Navy and Army do. They're much more specialized and kind of unique, kind of a niche thing that ultimately combines effects in the air with what's going down on the ground below.
Okay.
Yeah.
Makes sense. It's the Air Force, right?
Yeah.
A lot of times people forget that, all these different ones have, all the different entities of the DoD. They each have their own specialty, and they're there for a purpose.
Yeah. It takes everybody.
It does.
It takes everyone to win.
So what is the physical requirements of one of these individuals? I mean, just pick maybe one of those paths. I mean, they're probably all similar, but
they are. Physical requirements, if you rewind the clock all the way to when they start as baby enlisted airmen coming out of basic training, which, gosh, I don't even know how long that is anymore, maybe 12 weeks or something like that. They go next to indoctrination into at the start of the pipeline. Then they have to go to assessment and selection. Then they have to go through a series of schools, SEER, dive, military free fall. That whole process is extremely grueling. Not much sleep, tons of miles on all kinds of different surfaces, heavy loads, tons of fatigue. That's all before they even get to their unit.
You're really selling it here.
Yeah. Well, for some people, they're like, sign me up.
Exactly.
They love a challenge like that. But once they get to their unit and they're like a no kidding combat controller or PJ or TACP or SR that are ready to fight, their revolving requirement for fitness is actually policy now. It's called the operator fitness test. And I'll just go through it real quick. It's a 3-mile ruck with 65 pounds or 60 pounds. And then they go right into some events in the gym, broad jump, pro agility. They do deadlift, pull-ups, a farmer's carry with 53-pound kettlebells in each hand for 100 yards, and then 2 300-yard shuttles to assess anaerobic endurance. And then they do a 1,500-meter combat fin, which is in full uniform. No equipment, just their fatigues, if you will, and fins. And then they're done. So that's the revolving fitness requirement that they have to take every year to stay green or whatever. So they have to pass that to be able to go train and go deploy and all those things. That's the requirement. Now, a lot of guys, there's a ceiling effect with that test. So a lot of guys go way above and beyond scoring well on that test. And they have, their interests in physical fitness are varied too. Some of them are runners. Some guys are strongman lifters, power lifters, CrossFitters. So we definitely have those kind of shreds in population too. So that's their requirement and some of their fitness culture. Now, that doesn't even include like the training and things they do in the field. Yeah. Outside of just fitness, right? Yeah. So you start talking about like overcooking guys and guys having overuse injuries and that type of thing. Like that's a very real risk in our population because they're just always doing stuff. Could you guys just slow down a little bit and make my job a little easier? But
it takes that mentality to do that kind of job, right? You have to you have to want to keep going and
100%.
You can't give up. So that leads me right into my next question, which is like, so what does your role look like in that physical readiness? Are you treating injuries or are you doing more preventative type kind of
a little bit of both. In an ideal world, we'd have, if we had full control over everything, we would be able to identify all the little risk factors and mitigate those risks and prevent injuries. It's hard to capture injury prevention, but what we do, our process, and it's worked fairly well with and proven by our kind of our readiness numbers, and I can go over that in a second too. But when an operator comes to our squadron from the pipeline that I was describing earlier, we put them through a battery of tests to capture movement assessment. It's really the SFMA top tier, if any of the listeners are familiar with that, plus the lower extremity Y balance, and then we do a drop jump test. And so with those 3 data points, we can capture a lot of different things. Look for asymmetries is the big thing. If we can find asymmetries in how they
define that real quick for
Sure.
our general.
Yeah.
What is an asymmetry? It's general public, so we want to make sure they know what you're talking about.
Good point. Yeah, and feel free to stop me because I'll just ramble.
That's okay.
I can talk about this stuff all day.
It's all right.
So an asymmetry would be like, let's say someone hurt their knee in high school and they kind of got over it, but an asymmetry in the drop jump test, for instance, would be like when a person jumps off a 12-inch box and then has to jump up and come back down. We film that. An asymmetry would be, well, this left leg looks great, but your right leg just completely collapses into a valgus or an inward movement of your knee.
The knee kind of goes in.
Sure, like something, very obvious, that would be an asymmetry. And asymmetries have been shown to be kind of an injury risk, right?
Okay.
So that would cue us in like, okay, now we need to use those mobility kits that we discussed last night in the Hilliard. We need to target interventions and prevention through the mobility kit toward those asymmetries. So that's the idea there. Not just dynamic asymmetries like I discussed, but range of motion issues, like if they can't squat on one leg and the Y balance on one side, or they reach way further on one side than the other, that's another asymmetry. And then the movement assessment can tease out a lot of different side-to-side asymmetries in shoulder range of motion or what have you. So that would be our prevention measures. That's kind of our line of effort there, but we also stand by to treat injuries as they come up too, because they're gonna happen, right? We see a ton of low back pain and neck pain because, like discussed last night, the nature of the operator's tasks and their equipment just creates a ton of problems in the low back. So they carry. I can talk about their equipment real quick. They carry at minimum in the field, they're going to have some sort of armor, which is probably about 25 pounds. They're going to have a helmet on, which I think is like 13 or something like that. And they usually have a pair of night vision goggles attached to the front of their helmet, which those are heavy. They probably weigh 3 to 5 pounds maybe.
Oh my goodness, my neck is already starting
to
hurt just
you're
thinking
like,
about a helmet and
So they're kind of just sitting in that posture, and then they have the weapon, which is probably 10 to 13 pounds, tons of ammunition strapped to their chest, radios, batteries, sometimes a large ruck if they're a PJ, a medical guy with a ton of emergency medical supplies in their back. And then on top of all that, they might have a 40-pound parachute, that they're just sitting in an airplane waiting to jump out. So all of that combined just makes a lot of mechanical neck pain and low back pain. And then they do combatives, mostly like MMA or jiu-jitsu 3 times a week or 5 times a week. So there's injuries from that. So we're standing by to treat those injuries, myself and the athletic trainer. And the great thing about being right there with the guys is they can access our services same day, like same hour. Usually, I mean, they literally just kind of walk or hobble over from the combatives gym over to get care. So that's how we work prevention, but then also kind of that reactive injury sport medicine model.
And it's nice that they're right there, because the sooner that you can address the injury, likely that helps with recovery, I would assume.
Absolutely. Yeah. We get them what they need right away. Yeah. It might be just they need rehabilitation, like they need physical therapy day one. We tell them how to protect something and RICE, elevate, compress, and everything to eliminate inflammation day one, or at least get started on the healing process. Jumpstart that. Yeah. But it might be something where, like, hey, dude, you tore your Achilles tendon. Like, let me call the doc. Let me get you over to orthopedics right away. And we've done that, believe me. So it's not one of those things where you get hurt and then you waffle around for 3 to 5 days. You finally get in to see your doctor. Like, it's just right away. So I think that's probably the true value that we offer, or that PTs and ATCs offer in special tactics.
You talked a little bit about this last night. You go with them, and you said it earlier. You go wherever they go. So you're you're treating like in the field. Like you're not in some shiny clinic. It's sometimes you showed a picture you were treating in a broom closet. So
yeah.
Do you want to talk a little bit about how your type of strategy to approaching therapy is a little different than maybe somebody that they go see in their community?
Sure. Yeah, I kind of take the show on the road. I have to consider like resource management when I do travel. We have about 5 special tactics teams of about 15 personnel each, and they're all scattered all over the place. Like right now, they're scattered across the world. So I just have to be judicious in if I choose to go with one team, then I'm just with them, right?
Yeah.
So what are the other 4 doing? What resources do they have? So I don't get to go with the guys as often as I'd like to, but when I do go, so a good vignette is from last month. I went to South America with the guys for a big exercise down there with the Colombians, and it was awesome, by the way. But the guys were busy. They had 2 or 3 military free fall jumps the first week, and so when they're not jumping, they're mission planning, for the next thing. So they were just really busy. But I set up that table in the barracks, and I was treating guys from like when we got back at 1700 or 5 o'clock all the way after dinner, So just not your typical rehab look, but I'm still doing all the same recovery and rehabilitation type stuff that a normal PT does. I'm just kind of doing it in a broom closet, So
it's got to be, to me, it has to be a little bit exciting, but really fun that in therapy, you don't see the same thing every day, I don't think, but I'm not a therapist, but you never really know what's going to walk through your door.
Yep. Well, one nice thing is that I know all the guys personally at this point.
Yeah, that's true.
Which is really neat. We have 220 in our squadron. 100 and change of those are actual operators. The rest are support. But we help everybody. But I pretty much know everyone's name for sure, and then I might know, their spouse, their kids, their story, Yeah. And so you get to know their chronic history of injuries too, right? So, for instance, on that Colombia trip, I have a handful of guys that I just knew that they were going to need their neck treated, after the jump. One guy had carpal tunnel surgery on both sides a couple months prior to the trip, so I knew he was going to probably ask for some sort of treatment on his forearms or whatever, right? So I have kind of a head start, if you will. But there is a aspect of working in the clinic where you don't know what's coming through the door, so you kind of have to be on your A game. I kind of see him coming like, oh, he's going to ask me for something for his neck,
Just the way they're kind of walking and holding themselves.
Crooked the head,
I can see that. So you said you just have to be on your A game. So how much continuing education do you do? Do you just are you putting all the tools in your toolbox? Are you trying to get whatever you can, or are there things you really like?
I definitely have preferences. Like discussed last night, anything that is portable and light.
That makes sense.
And I can pack in, no kidding, just a Pelican case, which is like just a hard suitcase that I can check at the airport and take with me. Dry needling is fantastic. I've had a ton of continuing education in dry needling, courtesy of the Air Force. We actually train ourselves internally on that. It's really good, really good. I've done a lot of spinal manipulation training because that's another service that's immediate effect. I don't need any equipment for that other than maybe a treatment table, but it's surprising how you can use other surfaces, picnic tables, the hood of a Humvee. So,
hey, you gotta do what you gotta do.
Sure, yeah. So anything portable, I'm a huge fan of. I just did last week in Colorado Springs. Shout out to John Umloff, Major Umloff out of the U.S. Army Baylor program. He trained myself and some faculty up there on diagnostic ultrasound. And literally, I just have it linked to my phone or a tablet, and it's just that GEV scan handheld. So I can it's an app, I can see inside someone's elbow now, and just have it on the screen and show them like, hey man, you got fluid in your elbow. Like maybe we should take a break from jujitsu for a couple days,
That's pretty incredible.
So anything portable like that, and light, I'm a huge fan of. But I've had a lot of training just with differential diagnosis and decision making, fine tuning rehab plans, like training your brain to make smart decisions. I think is more important than any device or tool. It's really knowing how to apply the tools at the right time on the right person, the right place, where I think there's a lot of value.
Well, thank you so much. And I do want to mention Major Carson is a former Aggie or former student. You are an Aggie.
Whoop.
Yep. So, and we talked about this. You did not serve in the Corps.
Correct.
So how did you, for students that may be like, oh, that sounds so great, but I'm not in the Corps.
Yeah.
How'd you get where you are?
Sure.
Give a little path for them.
Yeah. So the military is ready to take most people, right? You don't have to be in the Corps or do an ROTC program anywhere to commission as an officer. And I'll talk mostly about that because everyone that's the students listening are already in college. They're going to graduate and have their degree. So to commission as an officer, you just have to have a degree. That's kind of the minimum standard. So for healthcare specifically, you can, well, there's a lot of routes to do this, but if you want to get into military healthcare, you have to have a degree, and then depending on what you want to do, like I'll describe the physical therapy way first, and then we can talk about a few others. Most physical therapists in the Air Force direct commission, whether they did ROTC or whatever. And so what that means is you contact a health professions recruiter. I actually looked up the ones around this area. There's not one in College Station. There's one in San Antonio. I looked that on airforce.com. You can direct people to that. You can just go down the rabbit hole of finding resources there. But contact a health professions recruiter, and they'll walk you through different scholarship possibilities for grad school, depending on what profession you want to go through. You might commission before grad school, and then they pay for your school as you go through PA school or medical school or whatever it is. It's called the HPSP program, Health Professions Scholarship Program, I think. Okay. I didn't do that, so I'll fact check all of this if you're listening. But then you kind of just owe back the Air Force or whatever branch based on whatever deal you made with them for scholarship, right? And normally it comes down to like
typical.
Yep. Normally it's like 4 or 5 year commitment after they put you through school, right? But if you want to be a physician, like sometimes they can put you through residency as well through an Air Force hospital or something like that, and then you owe them, I don't know, sometimes 10 years if they pay for med school, residency, and everything. Yeah. But for me, back to your original question.
That's all right.
For me, I graduated Texas A&M. I went to PT school in Dallas, and then I worked for a company in Dallas before I went to PT school, and they paid for my PT school, which is awesome. So I owed them 2 years of service, and they were great to work for, but I always wanted to serve. I just didn't get around to it. Too busy chasing football dreams. So what I did, I contacted that health professions recruiter, and they just set you up with paperwork. You start filling out lots of paperwork for your security clearance. There's tons of forms to fill out. They do lots of background check stuff, and then you put together an application, essentially, because a board of Air Force physical therapists meets to basically grade your application package and grant you, select you into the Air Force. Once they do that, then you go and you swear in, and you're basically in the Air Force at that point. Then they send you to a basic officer training or officer training school. And it's changed a lot, but I think it's around 10 weeks now or something. And they teach you how to wear the uniform, how to basically just be an officer in the Air Force. Yeah. Because you've already become a physical therapist. You went through PT school and everything.
Yeah.
And then you just go to your first duty station and you start learning on the job. So it can be as easy as that. Yeah. But with this, if you want a scholarship and you need help paying for school through the Air Force, I would direct you to airforce.com. And you can just keep clicking Health Professions Scholarship Program. There's also USU's or Uniform Services University for health sciences, and that is in Bethesda, Maryland, and you actually go. That is your degree conferring
Makes sense.
Yep, similar to U.S. Army Baylor. That's another option. But through HPSP, I'm pretty sure you can go to a lot of different schools. It's just you owe the Air Force something on the back end. So.
Well, it makes sense. I mean, there's even sometimes I know nursing right now is, really in need of people, and there's hospitals out there that will pay your nursing school. You just owe them service at the end, or you just
makes sense,
repay
right?
it. Yeah. It just makes sense. It's like you pay it in kind then, essentially.
Sure.
Yeah. It works out great.
Just encourage everyone to fact check everything I just said. It's
Absolutely.
been 8 or 9 years since I looked at all that stuff, so it's probably changed anyway. But bottom line, find a health professions recruiter. They can walk you through the whole process.
Absolutely. And thank you so much for being here, Major Carson. We really appreciate it. Are there any take-homes you want to leave with our listeners?
Yeah, I was thinking about that. I think reflecting back on the last 10 years of my career and just getting it started, coming back here is kind of reminding me of all the hard work, right? If I had anything to say to like a junior at Texas A&M right now, take initiative. No one cares as much about your career as you do. If you don't know what you want to do, find a mentor and go explore. If you do know what you want to do, find a mentor and then take initiative. Yeah. And be aggressive and make contacts. Show up on time everywhere you go. Make sure people know you're interested. And just keep clawing because you never know what kind of opportunities are going to arise, but you got to show up and you got to try hard. You got to seize the initiative.
Thank you for that. It's really important. I notice that with my students a lot of times. They're like, oh, well, I don't know that person. I don't want to just and they're sort of awkward about it. And I'm like, just practice. Just go, start practicing. No one cares. If you go up and you're a little socially awkward, it's okay.
It's totally fine. I talked to 10 people last night like that. But it's good. You only get better at that kind of thing by practicing it.
Exactly.
So,
Exactly. Absolutely. Well, thank you again so much for being here, Major Carson.
Yeah, my pleasure.
His talk from the Hilliard discussion, we'll put the link to it in the show notes so that you can watch it if you're very interested in knowing more about what he does on a day-to-day basis. And of course, if you ever have topics you want us to cover or speakers you'd like us to interview, please send us an email at huffines@tamu.edu. And of course, as always, stay active, stay healthy, and we'll see you next time.
Dig 'em.
We always do a fist bump.
Okay.
No problem. I like the gig 'em though.